and we launch straight into our health conversation for this morning. You know how we do it. You know that right here we bring you up-to-date information. We bring you discussions that nobody, or well, not nobody, but very few people will get into. We look at different perspectives and angles, and we go out there to get you the best to come engage you today. Today, we have a conversation around, still around health, but a conversation around AI and its impact on healthcare. And this morning, we'll be jumping into this conversation with Professor Ngwaba joining us this morning virtually, as he does always. Good morning, Prof. How are you doing today?
I'm fine. Good morning. Good to be here today.
Yes, good to have you join us as well. And we're launching into a terrain that is not very, not top of the discussions right now. A lot of people we're still thinking of how to survive, but here we are launching into a conversation around global health.
Oh, yes.
How
As we've been
important
doing,
is that?
oh, very important, Coyote. As we've been doing for the past 9 episodes, what we are quickly realizing is that global health has implications for how we survive our everyday lives. Some of the issues we've grappled with in previous episodes have shown that, global health is not as distant as it sounds. We've talked about, um, in the last 3 episodes, we were talking about trade. Every one of us trades. We pursue our economic opportunities through trade. But then we saw from the conversations we're having that trade has implications for health outcomes, including supply chain systems and how they can be the battleground during periods of health crisis. We saw obviously how they also have implications for social determinants of health. When you have a very good trading infrastructure, the community prospers. When the community prospers, they have access to all of the conditions they need to live a good health and good life. So yeah, as we pursue our day-to-day chasing daily bread, we should still be thinking about how government policies and actions and distant policy developments can have implications for our ability to live our day-to-day life and pursue our daily bread. So yes, I'm happy that we have this platform where we can actually engage with citizens and share about all of these connections and interconnections,
Hmm.
educate policymakers as well as they reflect on how they can improve the lives of our citizens. Yeah, so this is really very important.
Hmm.
And so
All
I'm
right,
excited
so
to be here.
great. And we will launch into this AI perspective shortly. But for our first-time listeners, Dr. Uche Gwamba is an assistant professor at the Lincoln Alexander School of Law in Toronto Metropolitan University and managing partner of Massfield Law Practitioners. And that is a transnational law practice with offices in Lagos, Abuja, and Toronto. Professor Ngwaba's academic journey began in 2010 at the Nigerian Institute of Advanced Legal Studies in Lagos, where he was a research fellow. I proceeded to Sydney, Australia in 2014, and while in Australia, Professor Ngwaba successfully completed the legal qualification degree of the Legal Practitioners Association Board of New South Wales, becoming an Australian trained lawyer in the process, which means he could practice in Nigeria as well as practice in Australia. Amongst many things, Dr. Ngwaba currently leads a program of research focused on advancing a regional health governance approach in the inter-American and African human rights systems, respectively. So once again, Dr. Ngwaba, welcome to the show.
Thank you very much.
All right. And having said that, let's AI, we use it to oppress ourselves online,
Hmm.
create images and
Hmm.
create videos. And
Hmm.
I fear what that will do in 2027 if you
Hmm.
suddenly see a video where the president of Nigeria directs Nigeria or tells Nigerians you don't have a right to vote. And Nigerians
Hmm.
say that, whereas it's an AI. So that is
Hmm.
what we're used to seeing AI do. Or for the sake of balance, you hear a Peter Obi say, well, he's leaving whichever party he is, then whether Labour Party or ADC, and is
Hmm.
joining APC because president is doing well. and
Mhm.
Nigerians will be saying it's true, it's not true. So we have that
Mhm.
concern and that excitement about the AI as we stand. However, when it comes to health,
Mhm.
how does AI play in that space?
This is a very important and fantastic question you've asked. So all of these uses, these mischievous uses of AI that you've mentioned, I would say they are the kids, they are the kids' toys in the AI store. The rest of the world, high-income countries and upper middle-income countries are way more advanced than that in the use and deployment of AI. First of all, I think it's very important for our listeners to understand that we are now living in the age of AI technology, big data. Whether we like it or not, on the African continent, this is the direction the rest of the world is going, and this is the new frontier of colonization, artificial
Hmm.
intelligence. And what does artificial intelligence really stand for? Really, it is the use of highly advanced technologies that are able to process big data and able to engage in very much predictive analysis to uh, apply to various aspects of human activities and functions, completely transforming how those activities and functions operate. Um, Many industries or many professions are currently being wiped off completely. For example, uh, back in the day, you needed people who were very proficient in coding to be able to put together the right codes and develop apps. Right now, you have AI softwares that can do that for you without at the prompt of a command, the AI software will come up with any code you want. And so what that means is that AI is completely revolutionizing the way human society is organizing itself, human society is functioning. But then with that organization, with that radical shift, there are, of course, obviously challenges, there are opportunities. Just the same way that, before the internet came, we used to write letters. I don't know if you remember those days when you write letters and then you go to the post office and you post it, you put a stamp on it, you post it. Maybe after 3 or 7 days, it will get to your destination and your friend will reply same way. And then the email came, and how many people still go to post letters in the post office box? I don't know the last time I saw a post office box. We don't we don't even use it to deliver parcels anymore because you have faster means of delivering parcels, and all of that. So that tells you how AI can potentially disrupt, society, just the same way the internet came and did away with the post office mailing system. Now you have artificial intelligence coming in and is doing away with how you understand the world. Now, let me apply this to the context of health. What does AI mean to the health sector? The question you need to ask yourself is when you go to the hospital, what exactly do you expect to receive from the hospital? You present yourself in the hospital, you say you're feeling sick. You're engaging with the doctor. You expect the doctor to diagnose you, to tell you what is wrong with you based on the symptoms you are experiencing. Now, imagine how that role of the doctor in diagnostic care is taken over by an artificial intelligence that can read into your history, your life history in a second, in a moment, and can tell you that based on what I am seeing and based on the patterns, this is exactly what is wrong with you with precision and accuracy. That's one thing that artificial intelligence systems can do. Now, what else can you do? Many of us, when you go to a doctor, you say, "Oh, this is my family doctor. I'm going to my family doctor. Why? Because my family doctor knows all about my history. He's been treating me for the past 20 years or 30 years. All right. I feel more comfortable discussing with my family doctor." Imagine that you don't need to go to your family doctor anymore. Why? Because your entire health record is available on a file, on a digital file where you go to any medical establishment and they can just click on your record and see immediately everything that you have ever experienced, even things you don't even know that you're experiencing. The the AI system can tell you, or the AI application can tell you that based on patterns I am observing right now, it looks like you're potentially pre-diabetic or something like that. So those are very powerful revolutions or changes to the way we experience care. So I'm talking about diagnosis. I'm talking
Yes.
about a prediction of diseases. Then also you can even talk about disease surveillance. You know, how do we tell patterns? Like, can we be able to predict that? Oh, at this very moment, this is the potential risk, public health risk that Lagos State is facing, given the population mass of Lagos State. We
Mm.
don't have that capacity. We don't have that technology. But AI technologies currently are able to, have data, population data sets, and look at those population data sets and make predictions about potential public health risk. And then policymakers are then able to use that data to begin to craft policies to respond to those population health risks, even before they begin to sort of break out. So you can see that these are very significant magnitude of, uh, 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 progress that is taking place in the health sector that is being revolutionized by artificial intelligence.
I mean,
So
as
let
you
me,
spoke, yeah,
yes.
as you spoke, I mean, on a lighter note, something just came to mind that all this diagnosis that AI does, we have something that does it even better in Africa, which is spirituality. People who fall sick, they are told, don't worry, the way you're about to fall sick, or you need to take care, and they do that, and even spirituality heals, which AI, which AI cannot do.
So,
But that's on the
so,
lighter note, though.
so that is our own African artificial intelligence.
Artificial intelligence.
You're right. You're right, Kyle. So sometimes there's nothing new under the sun.
Nothing new, it's just rebranded. Now, when you look at AI and all what you've said now, diagnosis, you spoke, one thing that you said that caught my attention was the fact that you could look at the population of Lagos, look at the demography and pre-inform us or alert us about the dangers, the health dangers ahead. Now, we've seen a lot of technological improvements that have happened abroad, but these technological improvements have failed. They've not been adaptable. The parameters that are used, or should I say they've not been adaptable or they've not been adapted. The parameters that are used are often based on parameters from should we say, the global north or some places that do not really align with us. With this AI, I'm sure there will be, what do you call this, patent on the AI, which means that you can't just pick anything and use, unlike what we do online. How adaptable will this be? Can it be trusted to understand the health and the body structure of the average African, or narrow it down to the average Nigerian and what we're exposed to, considering the predictions of COVID and how it fell through?
So this is a very important question you've asked. Actually, your question is loaded. There are three of so questions we loaded within it. So let me unpack the question for our listeners. First, you've asked about the adaptability of AI systems. And that question speaks to who are these systems being designed for. The second issue you speak about is um,
Copyright.
what are the restrictions? Are there restrictions to how these AI systems can be deployed
Mhm.
on the African continent? And that question really speaks to the ownership of the because AI systems run on data, and and data in the world of the AI of AI technology, data is the new frontier, is the new uranium, is the new precious mineral. All right. So let's discuss these questions very carefully. First and foremost, at the heart of your question is this idea of colonialism. There's now something we call data colonialism that is rapidly emerging, which is a phenomenon where precious data are being extracted and are being used for purposes that are not necessarily in the interest of those from whom those data are being extracted. The other aspect of it is very critical population sets that need to be captured in data sets are not being captured, and therefore AI systems that are being deployed for general use do not contemplate those population sets that haven't been captured. I give you an example with law enforcement. Because AI systems are neutral in the sense of whatever you put in, garbage out.
Damage out, okay.
So with AI systems, it is important to look into how these systems are trained, because those artificial intelligence systems, they are like a baby. It's like you give birth to a child and you keep feeding the child racist stereotypes or racist tropes about society. That child is going to become racist because that is all the child knows. So an artificial intelligence system is like a child that you've been sort of feeding information, that is data. Now, what we are observing, particularly in the global north, as you've mentioned, is a situation where data that is being deployed in law enforcement has bias, what we call algorithmic bias against particular population sets. So such data, as we say, when you see a black person is most likely to become a criminal, or a blacklist person is most likely to be about to commit a crime. Okay, and so because these data sets have not been trained to see that society is egalitarian, society, everyone is potentially good and potentially bad. So what you then have is that you have AI systems demonstrating bias in the way they operate. And so one of my colleagues who really does a lot of work in this space, he was visiting China, where they had just unveiled one of their leading systems. And everybody was able to come before the system and it will predict so many things about your history. And he came before the system and the system started glitching. And it was like, okay, that is because the system has never been used to train someone like him.
Yes.
Exactly. So imagine if such a system is being deployed in a very sensitive sector like health. To your question, is it going to be able to understand our bodies? The answer is no. It's gonna, because for example, there are certain conditions that you can observe from the coloration of the skin. For light-skinned individuals, it might show in particular discoloration, and you say, oh, this person is probably having this symptom or all of that. But a black person's skin would present a different kind of symptom. If the system has not been trained to interpret different body types, different skin types, what you're going to have is a situation where the AI system is going to be unable to pick or detect the issues that are wrong with this individual. And so you see how, because of our inherent bias as individuals, we have sort of transferred that bias to AI systems. Now, that is the algorithmic bias aspect of it. Then your question also implicates data colonialism or coloniality. Now, these aspects of the concern really is that we don't own our data. Why? Because we are not engaging in this frontier. The rest of the world is, breaking into this frontier, developing their AI systems, their AI ecosystems and technologies, and driving that. Africa is missing from the conversation. The rest of the world is developing rules for how these systems are to be deployed. Africa is only now beginning to think about, we need to develop our own framework and standards for how AI technologies are to be deployed on the continent. But even then, I was attending a conference in Cairo. I'll speak more about that in June this year. It was an AI in Health in Africa conference that was organized by the African Union Development Agency and NEPAD. So there I saw very interesting ideas, robust ideas about regulation of AIs, ethical standards and all of that. Very impressive discussions taking place. But then I said to myself, how come? Because I flew in from Canada to attend that conference. And where I was coming from, nobody knows that Africa is doing anything about AI or the regulation of AI. Nobody knows that is happening. Why? Because Africa is not a site where people think that this sort of leading ideas can come from. And so what that told me, or what that tells us, is that we need to begin to sort of like drive our own agenda, because no one is going to drive it for us. So I digress. Now, to come back to the point about coloniality, our health data is being mined, is being sourced to train these AI models, but we don't own them. This data is not even being kept on the continent. It's being offshored outside the continent. That's a weapon. That's a potential weapon that can be used against us, because you now have a pharmaceutical company go and patent that data, your health data, and they begin to develop therapies that you have no control over, that you have no say over. You cannot even use it for your own benefit. You have to pay for that. That's a problem. Okay, that's a huge problem that our policymakers need to begin to sort of think about. We need to begin to come up with policies, and we need to focus on developing investments in infrastructures that would allow us to become also players in this sector. Because if you don't play in the sector, someone is going to play for you. And you're probably not going to like what they will do with your data if you don't, step up to contribute to what your data is being used for. So that is for these aspects of the conversation.
All right. Now, when you look at all what you've said right now, the first question there is, following your Cairo, before we even get to your Cairo experience, what really is, or are African leaders truly doing anything at all, or by extension, the global South? Are we doing anything about AI infusion into health, or are we just waiting for the global North to finalize, then we begin to seek access to use the AI, infuse it into our health?
That's, I think, okay, that's a very interesting question. I think what I would say is that the politics, okay, our political class, our policymakers have not fully grasped the magnitude of the disruptions that AI will pose for the health sector, or essentially every aspect of our society. Because I was in Nigeria for the past 3 weeks, and I was obviously sounding out what was happening in the development space, what was happening in every space, where policies have implications for the kind of work I do. And I didn't really hear much. The concerns, the things that were animating the society, it wasn't really what I would say gave me any sense of confidence that at the political level, something is taking place. Maybe things are happening behind the scenes. Maybe these policies are being crafted, and I'm aware that Nigeria is currently in the process of developing its own AI policy, because I only know this because one of my friends, who is one of the world leading experts, at least from the global South, is quite involved in that process. But we are still lagging far behind. At least when I saw what I saw in Egypt, convinced me that we're still behind. Okay. Other African countries are doing a much better job of sort of driving this through. So on the political side, I think we're not doing much. But then I think that there are a group of professionals, academics, who are beginning to sort of push the needle in this area. And I think that based on the work of these individuals, that the expertise, the knowledge base about how AI can be leveraged and how AI can be managed to advance societal progress. Okay, I think the knowledge base is being developed, the capacity is being developed. Okay, but then there needs to be a convergence of, this, bargaining capacity from, academic experts and policymakers. There needs to be a very well carved out national policy on the uptake of artificial intelligence in various domains, but in the health sector in particular. This is because in the global north, amongst high income countries and upper middle income countries, these things are already being deployed with very significant consequences for population health. And also because our data sets are already being extracted without our involvement and without our consent in how that process is taking place. Our data sets are already being extracted by technology companies who are coming to set up operations in Africa. They say, oh, we've brought a solution that can help XYZ. Meanwhile, it's a solution that is a backdoor for mining of health data from the population. And then we don't know what uses they're going to put those things to. And when you don't
beyond, you get back to this, but beyond the illegal mining of our data, if you look at health tourism, is that not enough sample for any AI company or government in the world to have an idea of the kind of solutions they need to provide for our nation? For example, look at the number of Nigerians that go to India, for example, annually for different treatments. Number of Nigerians that go to UK in particular. I mean, Canada doesn't. I doubt you have a number of people, a lot of Nigerians coming there yet. Maybe you need to work better because we only go to where we have the best. That's why we don't need the best at home. So I mean, is that not a risk on itself that based on this access they have to these Nigerians over there, solutions, AI solutions could be developed for Nigerians, which means that then Nigerians will be losing out because those in the West, in the global north, are already ahead.
Okay, so that's an interesting question. My major concern is whether or not the number of Nigerians that are going out to these places are a representative sample of the
Mm.
population. Okay, many of these Nigerians are elites. They belong to the class of the elites.
They
I mean,
can have
if you
kwashiorkor.
anybody that can go to India is definitely not poor because
Mm.
anybody that can afford flight ticket is not poor, you know. Um, and so what that means is that we are only seeing just a very small subset, a very, very small subset, because the middle class in Nigeria has contracted significantly. So just a very small subset of the Nigerian population. Now, the kind of data that will be meaningful for AI systems will be population databases, population data sets. Imagine Alimosho, well, I think it's the largest local government in Lagos. Is it still the
Yeah.
largest local government?
Yes, it is,
Um,
even in
uh,
Nigeria.
Exactly. So imagine any system that plugs itself into the Alimosho environment, and you're able to mine data from the citizenry in Alimosho. That gives you a very significant representation of what population health issues in Lagos State might look like. Maybe not fully representative because, of course, those in Banana Island, VI, and all of that, they are a different breed of human beings. They breed a different kind of oxygen from the people in Alimosho.
Yeah.
But the kind of data sets that will be that AI systems can really use to do something meaningful will be the ones they mine directly from the communities. And so that brings me to the point I mentioned earlier about mining. What you really need to be more wary of are those, uh, foreign businesses that are coming from China, from all of these countries, from the West, to say, oh yeah, we're coming to establish a technology-related kind of business where we're going to be providing XYZ services. A lot of the times, these businesses are a front. Behind them, they are extracting data from the population because when users come in to interact with these systems, of course, they are giving their data freely to these systems. These systems are able to then mine and extract these data sets and put up a composition of information about the population, which they are then able to sort of offshore to their databases, abroad and use it in any way they want to use it, and usually without our input. So that's where the real danger lies, really.
Mm. All right, now let's go to Egypt, to Cairo, where I mean, the conference you attended, and let's explore what really are we doing with AI in Africa as at now.
Fantastic. So the African Health XCon conference was very eye-opening for me. One of the things I discovered was that um, there are a number of very strong discussions taking place on the continent in terms of developing policy for artificial intelligence regulation. And that discussion is being led by institutions like the African Union Development Agency
But
and the
Prof, before, sorry to interject here, before you continue with the details, I just want to find out, apart from you going there as a private Nigerian citizen, was Nigeria represented politically or at that level, or that was not a kind of meeting for political representation?
Oh, it was a meeting for political representation
So
because you
were we
had,
represented?
yes, we were.
Okay.
Yes, we were. In fact, I ran into the Director General of NAFDAC. She delivered a paper at
Okay.
the conference. So it was a huge conference. It brought together policymakers, political, highly influential political individuals. Matter of fact, there was a minister from, is it Namibia or so, who delivered a keynote address. Very brilliant lady, young lady, Minister of Health from Namibia or thereabout. So there were a number of high-profile individuals, and the program was actually hosted by the president of Egypt. So it was that kind of program. It was held in the equivalent of their most prominent event venue or conference center. So and it was a program that was there to talk about the state of AI policy in the health sector in Africa. The program was actually I was invited to come to present a paper, participate in a panel by the African Union Development Agency and NEPAD, the New Partnership for African Development. And so it was very interesting. It was very interesting to see the kind of conversations that were taking place there. Very prominent health institutions on the continent, like Africa CDC, were also leading the conversation. They were very prominent there. What I realized was that, and this was from the tenor of the conversations that were taking place at the conference. What I realized was that there is a growing base of professionals on the continent who are doing phenomenal work in the context of AI and health. And as a matter of fact, since that conference, I've been receiving several emails about follow-up meetings and discussions. And as I speak to you, a follow-up meeting is actually taking place in Kenya, from that organized by Africa CDC and the Auda NEPAD, carrying on the conversation about developing AI policy guidelines. I was invited for that. I've just been unable to attend that because it's just coming so soon after my return from Nigeria. But then this is all to say that there's a lot of work taking place at a continental level, in crafting an AI policy for the continent. What needs to happen is we need to begin to see investments, because in the conversations that are taking place, one of the sticking points is how Africa's infrastructural gap continues to be a huge problem to leveraging artificial intelligence, in health. AI systems, they need lights, unfortunately.
The elephant in the room.
They need lights.
You don't want to speed up people's death.
Exactly. They need access to the internet. Nigeria's internet situation is still very poor. I was burning data like I was burning pure
pure water.
I'm telling you, it was just like I put 25 gigabytes and after 24 hours, it's telling me you need to put it. I said, what is going on here? How is this 25 gigabytes going? Because my knowledge of 25 gigabytes is that it's supposed to last you for a bit, but apparently these data are not meant to be. You're not supposed to use it for everything. You use it and switch it off and all of that. So I wasn't used to that, because where I was coming from,
welcome back home.
You just use data. You just use internet data. So it was a shock. It was a shock to me that, it's not exactly cheap. So we need to invest in that. We need to invest in education. I don't know how many of our institutions, how many of our, whether at the primary level, secondary level, or tertiary level, how many of our institutions are beginning to introduce curriculum focused on AI, artificial intelligence, and its impact in the, in different sectors. My knowledge is that maybe not so much is taking place there. And something tells me that our national education policy has not been updated to really leverage and focus on training the next generation on artificial intelligence. That's a huge problem, because it means that you're beginning to develop AI illiterates, because Nigerians will leave, we finish their education, their course of training, and they don't really understand and are not engaged with that framework. But that is not a concern, because Nigerians are very enterprising. We're a very driven population set, and that's perhaps our greatest resources. And our greatest resource base is really our drive. And I'm very much confident that even if Nigerians are not taught, Nigerians can self-teach themselves because a lot of the things that are happening right now in the space, many of them are done by people who were self-taught. But that does not take away the primary responsibility for us to craft specific policies around this. So we need to have a wholesale revamp of the way we train our nurses, the way we train our doctors, the way we train our professionals in the health sector. Because for them to be able to properly utilize these systems to transform the way we deliver healthcare, these things need to be happening. In Egypt, I come back to my Cairo conference. In Egypt, my observation was that there is, to my mind, a very specific national policy plan. Like you could see that the Egyptians are really, they're very intentional about this. At the conference, there was a trade fair that was taking place where technology products were being sold. And I saw so many of those products that were supposed to be done by Egyptian technology companies. Well, the question might be whether or not they manufactured it themselves or whether they did it in China
Reassemble.
and fabricate. But that's beside the point. At least they have the sense to be marketing products that they say is tailored to their country. I
Yeah.
didn't see any stand for many Nigerian tech company in health. I don't even know if there's a Nigerian health tech company that is producing tech products. Maybe there is, and I'm not aware. But the point is that, I could see that the Egyptians have, they
Was
are
visible.
visible. You can see
Yeah.
visible signs that these guys are really doing something about this.
And that leads. I was going to ask you a question, but I wanted to land on this. Your experience in Egypt. We'll come back to that, but quickly before I go to my question, listeners, like I promised from last week, that we'll begin to read your messages. Some of your messages come in and we're unable to read it because of time, but it is our show. It is Today in Global Health. It's for us, so you can send in your messages to us on 0809 234 5913. 0809 234 5913. Share your messages with us and we will read it out. But, Prof, you just spoke now about Egypt technology companies creating marketing technology that was made by them. Like you said, poem pop, whether it was done start to finish by them or they assembled, as long as it is their product, it means they are intentional about it. Now, when it comes to AI, I have a series of questions here, so I might interject from time to time as you speak because I don't know if we'll be able to do a part two, but I want us to exhaust this today.
Oh no, there are several parts coming.
Okay, okay.
There are several
So
parts coming.
when you look at the AI, for example, whose responsibility is the investment? Government, private sector, who plays the bigger role?
Certainly the private sector, but then government has a very important regulatory role to play. I mean, if you look at the global north, for example, the West, where AI technologies are revolutionizing things, it is actually private investment firms. Nvidia is one of the biggest chip makers that is impacting the field. The stock markets raising huge revenue. There are huge. There are so many AI companies that you don't even know about. They are so unknown, but they are really making significant impacts, in the sector. I know this because one of my friends is a big player in the sector in terms of investment. He invests a lot. He buys a lot of AI stocks and all of that. So he tells me, this company, do you know this company? They're responsible for this. The other one, they are doing this. I say, really? I didn't even know that they exist. You hear the names. They're
Right.
very obscure names, but they are really making impact. So this is all to say that they invest in the infrastructure because, I mean, we have long passed the situation where the government does everything. The
Yeah.
infrastructure needs to be driven by the private sector.
Mm.
Our
So,
our banking sector,
yeah.
our stock markets, our businessmen, and all of that. This is where they need to be sort of
So,
investing their
so if I
resources.
get you right, you're saying that the federal government, in our case in Nigeria, has the responsibility to chart the course and let everybody know this is the next frontier. Then that will galvanize the private sector who will bring in their cash and their expertise to fall in line with what government is saying.
Absolutely. You
Mm.
see, millionaires, billionaires are created by governments. We are created by government policy. Nigerians, one of the biggest grounds they always have anytime, the name Dangote comes up, they'll be like, yeah, that he got all kinds of concessions and all that. But that is the case in every part of the world. Elon Musk has became the richest man in the world because of a lot of concessions he got, defense contracts.
Yeah.
SpaceX was getting government contracts to
What
fly things
about
to
the
the moon.
current president himself, Trump?
Exactly. The present president himself, he is a product of the system and all of that. And so, in other words, in every part of the world, unicorn companies are built by enabling environments created by companies, by governments. Okay, huge, companies that can transform the entire country. Like currently, Nigeria has one of the biggest refineries, at least the biggest refineries on the continent, and one of the biggest refineries in the world, because of a private investor who invested in that sector. And that sector is now impacting the petroleum sector in the world. European companies are beginning to shut down or contemplate shutdown because of Dangote refinery.
True.
Do you understand? So imagine if we didn't have a Dangote refinery, Nigeria is not going to be on the map for.
But when just like you mentioned the Dangote refinery, when you look at that, Dangote refinery came in at the time where the refinery, we say subsector of petroleum or the oil sector, at the time where it was full blown. Many refineries all over the world, it came in with a strategy, carved out a niche market, and keeps providing for them. When you look at the AI systems, is it full blown yet? Is it saturated yet? Or are there still opportunities? At what level, in fact, are we with AI applications and infusion in health?
I think the answer to that question is it depends on the part of the world you are. If you are in the global north, I would say that we are now at a stage where we are beginning to see penetration. Okay, we're beginning to see penetration into like various sectors. Like you come up, you can walk into the office, and then you say that, oh, this job you used to do this way, it's no longer being done that way. It's now being done in a different way because of AI. So right now, entire professions are beginning to be wiped off. They are no longer fashionable. For example, laboratory science is no longer a thing because AI systems are doing the job of laboratory scientists and all of that. So in a few short years, many professions will no longer exist the way we know them. So in the West, I would say that we are at a point of saturation, we haven't gotten to saturation yet, but we are in the point of uptake. It is being sort of uptaken in different sectors. Even in my legal profession, where I teach law students, we now have over 3 or 4 courses on artificial intelligence and the law. We're training our lawyers on algorithms, on how to develop algorithms for their own practice and all of that. Our students are beginning to learn about data and coding, okay,
Wow.
in the law. And that is quite consequential.
Let me
Yeah.
not trivialize. I was going to say, but we are still wearing wigs, but it's okay. We will.
It's not a trivialization. It's a fact. It's a fact.
We'll get there. But as it stands now, what does it really take? Okay, so we said the government needs to show that's the next frontier. Then the people
Create the policy,
yes.
make it a very interesting to invest in infrastructure for AI.
Now, when you talk of AI, and I've heard you mention infrastructure for so long, the average AI that the average Nigerian is exposed to is software, click and play, and it gets all what you want. No coding, no hardware. But when you talk of AI for hospital, the healthcare sector, what are we looking at? Are we looking at hardware, investment in hardware, or is it investment in software? And again, in addition to that, when you infuse AI into the healthcare, into the health sector, would you need specialization to handle it, or will it be a plug and play? So 2 questions in one.
Okay, let me take the second question first, and I'll come to the infrastructure question. Um, there is a level of training that is required for you to be able to read, interpret, and you deploy those systems. For example, as I told you, my law students in my institution are being trained about AI. Part of that training is to understand, first of all, what are the issues? What are the animating issues? What is the vocabulary? How do those systems even operate? How do you run the system? So that is to the second question. Now, to your first question about the infrastructure, what kind of infrastructure do we need? Software, hardware, and everything in between. To the hardware, one of the AI systems, they depend on very huge data farms. Okay, I don't know if this idea of a data farm is a place where information are stored. So in the West, one of the things that makes technology companies very profitable is that they are able to invest in the creation of these data farms where data is stored. Like if you see some of the sites where this data are being stored is massive, it's huge. You know, Google and Apple and all of these tech companies, the reason why they are now big players is because they invested in this
Data.
infrastructure.
So,
You
which
understand?
means that if you're to consider data, Kenya is better positioned because a lot of
Oh,
these
absolutely.
tech companies, they have good offices, headquarters. Africa headquarters is in Kenya. So it means AI will be an easier rollout in Kenya than in Nigeria. Because even the UN, some UN headquarters and stuff, they've been in Kenya for eons. Up until
Not,
recently that Microsoft came to Nigeria and is expanding.
yeah, so not necessarily. I will be very wary to depend on
Okay.
the fact that these companies are going there because the question is, if you're going there to just put your annex office, that's not good enough.
Mm.
Many of these companies, their data farms or their data storage centers are located in their countries, and this data is just
Okay.
offshored to
Okay.
their countries. So what you really need to be watching out for is the physical infrastructure being built. What kind of infrastructure is being built? You know, for Nigeria to be a big player in the sector, we need to develop in the physical infrastructure. We need to be able to have our data stored. When we gather this data, it goes to the farm. It needs to be able to be reposited physically here on sites. Those investments have to take place, you know, and the value chain, like any other industrial sector, where different parts converge together to produce the product. So the physical infrastructure we combine with the software, we combine with the professional skills, we combine with the policy ecosystem that supports all of that, and then you then have your service delivery. So there's still a long way to go. Nigeria is still struggling at the very basic stage of support data. We're not even talking about the AI data
Mm.
infrastructure. We're talking about
Basic.
regular infrastructure, basic infrastructure for a regular everyday life, like for
Mm.
example, constant electricity, you know, constant available water sources, because these
Yeah.
data farms, they consume a lot of water.
Mm.
Water sources, access, and then of course, population-based access, because for AI systems to generate data, the population needs to have access to data. Like people need to be plugged
Mm.
to the internet,
Mm.
because it's when people are using internet systems and putting their information out there that these systems are able to mine those systems and generate
So,
that data.
let me ask you this question then. You've spoken consistently about data and what it needs. Now, the question is that looking at the kind of data we have, in an event where we have the AI synced into the hospitals, and there is a failure either of electricity or internet access, what are the dangers it portends? But while you answer that, let me take this question from, I think this is Peter Newland. Let's see if you can answer it as well. It's a voice note on WhatsApp.
Prof, yes, what can we actually do to security trends?
All right, Peter Newland. Peter, I don't know if you heard. Did you hear what Peter Newland said?
I didn't hear, but if you can read it out, if you can tell
Okay,
me what
yeah,
he
I mean,
said.
he just said I was asking. It's not very related though, although it's AI. He was asking about what our government can do, how we could use AI to reduce incidents of insecurity in Nigeria. But I wouldn't want you to get into that so we don't go off course because though it's AI,
Mm,
but we are looking at
mm,
health. But let me take
mm.
just one message because we are out of time. And this is Jay from Okoko Michael, somewhere close by. Says this AI conversation is very vital. I was able to change my pollen allergy medication using AI. The medication I use now is very effective with no adverse effects on my body, thanks to AI. And I think that's the precision you were referring to earlier.
Yes. And so, look, I'm happy to hear that people are beginning to sort of generate awareness about this and
Yeah.
interest
But
because
anyway, although I said Okoko, it's not Nigeria's Okoko, it's somewhere in Europe. He just prefers to call it Okoko. All right.
Uh, so yeah, but then I think in the nutshell, I can see we're really running out of time. But look, we're gonna have more further conversations. I'm gonna invite one of my colleagues, the person I was speaking about, Professor Jake Fordu. I will invite him to the show. He's been doing he's doing us a lot of proud things to be, and Nigerians can be proud about him because Professor Fordu has helped many countries develop their AI policy. He has advised governments around the world on their AI policy. And so it's been very interesting to have him join me on the show, and we're going to talk more about this topic. What I want to leave with the listeners is that AI is the new frontier, and whatever it is you're doing, you need to begin to think about what AI means for what you're doing. Whatever profession you're involved in, think about how prepared you are for the disruption that AI is going to bring into that profession. And the health sector, we need our health professionals to begin to think about how they can leverage AI to get their jobs done better. Policymakers need to think about how they can deploy AI policies in a way that is responsible and ethical, and in a way that works for the best and the good of the population. And I'll leave it at that.
Mm. Thank you so much for your time again this morning, Professor Ngwaba. It's always a pleasure having you. You couldn't respond to my question, but I guess the next edition we'll get more into that, because the question was in an event where we've gone partly AI and there is a power outage, electricity is not able to come on immediately, or suddenly there is a cable breakage and the internet is discontinued. What happens? And it
It's a
goes on for
problem.
like 5 hours. But we'll get into that next week because
We'll
we're
get
already out
into
of
that.
time.
We'll get into that, but it's
We'll
going to
get
be a
into that.
problem.
It's going to be a problem. And the concerns about if it will not make us weaker as a people and less efficient. Because if you feel, oh, AI will do the job, would we still be able to produce the top medical practitioners like we have done over the years, people that really represent us globally? But we'll get into that conversation next week. Thank you so much once again for your time, Professor Uche Ngwaba.
Thank you very much. Yes.
And Prof. Uche Ngwaba is an assistant professor at the Lincoln Alexander School of Law in Toronto Metropolitan University and managing partner of Massfield Legal Practitioners with offices in Lagos, Abuja, and Toronto.